Hi, and welcome to Surviving Out of Spite. I'm so glad you are here because I love talking to you, and I am just really excited to have a formal, informal conversation with my friend Meredith on the podcast. So I will give you a moment to introduce yourself, a little of your chronic illness story, so everyone can understand why you're here.
Well, thanks for having me. I
Mhm.
think it's so important for those of us who are comfortable to share our stories. I'm
Mhm.
Meredith. I live in the Washington, D.C. area, and my initial diagnosis is ulcerative colitis. So I got really sick during college, like out of nowhere. One day I was totally fine, and then within a week I was crashing in the ICU, and they had no idea what was happening, but it was kind
Fun.
of yeah, like super fun, especially when you're in college. And that was the one year I had like a communal bathroom on the floor. So I had to like book it from my dorm to the bathroom down the hall. That wasn't fun at all. Not fun at all. And so got really sick, ended up in the ICU. And like the one silver lining of that is that I got so sick so fast that they did an emergency colonoscopy and like found immediately, like, okay, you have toxic megacolon, which is, really severe UC where everything is just so inflamed. I was on the verge of sepsis. So where some people have a really long diagnosis journey, that's kind of one thing I'm like, okay, like I was lucky in that regard that,
Mhm.
they kind of thought I might die, but at least I got the diagnosis. I had really great doctors at Georgetown Hospital. I was able to avoid emergency surgery and called that my home for about 2 months. But like, in the scheme of everything, I was in school at Georgetown. So I just kind of
Mhm.
had to walk across campus. And although I was ambulanced across campus and and was hospitalized there. So my friends could come, my professors came and visited me.
Wow.
Um, and so that began my roller coaster of an adventure in our healthcare system. And which is, as we all know, super fun.
Yeah,
Um,
we
yeah, it
love it.
ended up so much fun. I ended up getting surgeries, a total proctocolectomy about a year and a half after that. So they removed my large intestine and rectum. And so now I had a temporary ileostomy for about 2 months. And now I live with a J pouch. Um, and so that's internal. And
Mhm.
since then, I've acquired a smorgasbord of other conditions, as many of us do. So I have POTS and EDS and PCOS and all the other, you know, alphabet soups.
Alphabet soup, yep.
Yeah, exactly. And then I've always had chronic migraine. Thanks, Dad, growing up. But yeah, after all that, I realized, wow, that sucked. No one teaches you
Mhm.
how to navigate our healthcare system. And so even though I was studying Arabic in school, when I was able to graduate, I said, okay, I need to do something to help improve the patient experience for other people.
Yeah, you know, I'm always amazed to like, especially with people that I know, but when I have friends who have these incredible stories and I sit here and I listen to you tell it in that like more professional way than, we talk to each other about illnesses, right? I'm just like, how? How? Right? Like, it's
Yeah.
an incredible in so many different ways because it's that survival of like, I see what you go through. I know what you go through. We've commiserated over what symptoms that are
Yeah.
similar and like experiences that are similar. And then I'm just like, how the hell are any of us still here and
Seriously.
upright? Like,
Yeah.
and not even just like alive, but actually functioning. And it's mind-boggling when I sit down and think about it. And you might do this too, where it's like the things that are normal in our lives now that like you don't think about anymore because it's your day to day. And then somebody
Yeah.
on like the outside comes in and they're like, what is that? Or what are you doing? And you're like, oh, this is normal. Like, what do you mean? And then you sit back and think about all the things that you have survived. And like, you really sit with that for a minute. And it's so overwhelming with any and every emotion because like you're
Mhm.
grateful, you feel proud, you feel shock, grief, acceptance, anger, sadness, like alphabet soup of emotions there. Like
Yes.
there's
All
just
of those things.
so many things and I'm like, how the hell are any of us here? Let alone like, hold on, I just noticed 1,001 problems. I'm going to be the one to fix all of them.
Mhm.
I'm gonna take on the weight of the world on my
Yeah,
shoulders and go into it. And here we are.
exactly. And it does feel like, just fighting to live another day in terms of our personal health
Mhm.
and also professionally being like,
Yeah.
you guys, you need to understand this. And if we all just talked and like collaborated, we could make our healthcare system so much better. But
Yeah.
it's funny that you mentioned that because I was just having the same kind of moment like 2 days ago whenever I'm
Mhm.
doing something and I'm like, oh, like, I don't want to do this. This is so hard. I think back and I'm like, you're so stupid. Think of all the things that you have survived. Like,
Mhm.
I've gone through opiate withdrawal like more times than I can count, getting those surgeries
Yeah.
and and all the hospitalizations and you're like, "Pfft," like remember how you're feeling in those moments? I can
Mhm.
do this like exercise or
Yeah.
I can unload the dishwasher. But
Mhm.
honestly, it's still really hard to do that. You were talking about
Yeah.
sitting upright. I couldn't sit upright like 2 years ago.
Only imagine.
And
Yeah.
even still now, I'm in pain sitting up, but I can sit up. And something
Mhm.
as simple as that is just like such a huge victory. But it takes so much self advocacy to get to that point
Yeah.
um, in order to get to have the care team that you need,
Yeah.
which we know as a whole, we were just talking about. It's literally a marathon, Ironman, whatever you want to call it. But
Mhm. It's a never-ending
yeah,
ultra marathon. You don't get
exactly.
to stop, and
Ever.
it's funny too, talking about, like, unloading the dishwasher or those, like, the small things, right? Like, you're like, "I've been through this, I can do that." Like, come
Right.
on, get over yourself, right? We can
Hmm.
only talk like that to ourselves, like,
Right.
acknowledge, like, if someone else talked to me like that, they'd get a backhand real quick, but, like, me, I'm like, "You can do it, don't be a little bitch, go take care of it." But I've
Exactly.
realized over the years that those small things have become so much harder than the big things. Like in December, right? Like the month of December for me was insane and I was septic again and dealing with another infection, more surgeries, the trauma of being back in the hospital and then when I got out of the hospital, I got COVID and so did my husband and we were so sick like through the entire month and I'm like by the end of it, you're so drained, like you've got
Hmm.
nothing left.
Right.
And yet, it's like I have to make a phone call to make an appointment or do something, and that feels so much harder
It
than
is
the other
so
things that I
hard.
went through. And I'm like, what?
Yeah,
Why?
and I love too, you just said all that so casually, like, "I was septic again," like, "surgeries, blah, blah, blah," and I know we had to reschedule this,
Mhm.
once because of me, once because of your schedule, and you emailed me and you're like, "Hey, I'm inpatient," and I was like, "That is a very valid, like, reason," you
I'm
know,
sorry I
ve
can't be there.
and and I told my husband, I was like, hashtag chronic illness life,"
Mhm.
like, but yeah, just casually, like, "Hey, this is just part of our existence."
Yep.
But it
Yep.
is true. Just like you get so drained from all that. And then you think, like, wow, if other people, other, quote, healthy people had to
Mhm.
experience what this is like, we've built up kind of that muscle of being able to
Mhm.
cope and adjust to all of these things. But yeah, it's, and many of us don't like to hear like, oh, you're so inspiring or something. So you're like, what the hell else am I supposed to do? Like, I
I'm
need
just
to
living.
I'm
I'm just
just trying to
surviving.
surviving. Yeah. So, anyway, just like, yeah, the just casualness with which you said that, and, any other person would just, like, crumple. But
Yeah,
this is
it's
this is life.
yeah, it's funny because back in the beginning of my journey, it was like social media was like kind of just becoming a thing at that point. Like, I remember, I think it was maybe my junior year of high school that Facebook was like a thing, but it was only for the college kids at that point, right? So I couldn't make a Facebook account until my senior year of high school when I finally got into college and you get the email and all that kind of stuff. And it was like, having the is after the status, right? So like Samantha is, and then you put like just thinking back to that moment. And when I got sick, we were so used to sharing so much at that point because we didn't know what we were doing. And we're like, I'm eating a piece of pizza, or like, I'm going to the library. Like, nobody cared. So
Right.
it's like you're sharing all of these things, like, so casually, but also because it was a good coping mechanism to kind of talk about it, and we utilize like, our generation utilized a lot of that like a diary,
Yeah.
and, how easy it is to put things out there, and then once people start hearing your story and they're like, "You had that and then you did this?
Yep.
No way." Like, that's so inspiring, and I was always happy to hear that in the beginning where I was like, well, if I can inspire you to do something, like, I want to do that. And I was happy to be that person for somebody. And to a degree, I still am. But I'm like, to
Mhm.
your point, when someone's like, oh, you're so inspiring, I'm like, bro, I'm just trying to like get through today. Like, this is not
Right.
inspiring. Like, I'm just here. And
Exactly.
I think it's the like evolution of how you accept and grieve and handle and think about
Grieve.
yourself in your
Yeah.
own illness, where like at one point I was only illness. I was like, if I couldn't talk about my chronic illness, I didn't have anything to talk about, because it was such a big part of my life. And it was
Yeah.
for everybody, because you're trying to be like, I used to have this, but I don't have that anymore. So this is the only thing I have to talk about. And
Yeah.
now I try to avoid talking about it as much as
Really.
humanly possible,
I can
because I'm
relate.
like, I just don't like, there's more to me than this now. But then I'm like, what do I do besides like chronic
Right.
illness stuff? So
Yeah.
what do I talk about? I don't know. It's a very interesting evolution of, at least for myself, like, who am I? What do I like to do?
But I think there's like there's some nuance there because I feel the same way. Like my whole health journey has just changed me so fundamentally. And I still kind of
Mhm.
think of my life as like, Meredith 1.0 pre-sick and then
Mhm.
post-sick. But not just in terms of like, of course, there was a lot of grieving. There's still moments of
Mhm.
grieving,
Yeah.
but I also have learned to have so much more empathy and
Mhm.
realizing like what is truly important. Like I've always been
Yes.
super high achiever, like been conditioned to think like you need to do something super like quote prestigious. And
Mhm.
now I'm like, I was gonna go to law school just to like please other people. And and then once I got sick, I was like, "Pfft, screw that. Like
Mhm.
life is so you don't know when it's gonna end. I just want to do
Yeah.
something that brings me joy and that can help other people. So I feel like you can really like in terms of like what am I other than my chronic illness, you can like
Mhm.
sit in that and internalize it and that can, you know, potentially be destructive or something that is not like sustainable for you and like a good like it doesn't serve you. But I
Yeah.
feel like what we do is you and sorry if I'm speaking putting words in your mouth, but we use our experience and kind of that part of our identity to like help other people and to like like repurpose that traumatic experience in more meaningful positive ways because you can
Yes.
understand what it's like all of
Yes.
these other people out there who we're speaking to now like and helping other healthcare professionals realize hey, this is what we're going through. So
Mhm.
I think you use what you got. And
Yeah.
so I think that's we're doing something meaningful from the crap that we've gone through. And so I think
Yeah.
that's a little bit more I don't know, using the crap for good. And
Yeah.
so, but I feel the same way. Like on
Yeah.
Saturday, we're going to like hang
Uh-huh.
out with my husband's work friend. And I already know that his wife is an OBGYN who I haven't met before. And I was like, okay, at least I know a lot of things to talk about with her. But,
When the medical
it's
jargon
so
comes in
funny.
handy, you can hold your own
Exactly.
with them.
Yeah. But
No.
no, I really relate to that. Thanks for sharing that.
No, I honestly, like, you said it in the same way that I would have, where, like, I think about who I was before I got sick and like what I wanted out of life. And like there was nothing bad. I didn't dislike myself. I don't think back to like that personality or like you said, like version, 1.0 of Sam and think like, ugh, I don't like that. Like it doesn't feel
Hmm.
that way. But the
Right.
person that I became because of what I've gone through, like as much as I wish that I never went through all of these things, and I know you
Right.
probably feel the same way about your journey, but like where it brought me in life, the purpose that it brought me, the experiences, the good experiences that it brought me, and connecting me to people like yourself. Like I wouldn't know who you are if it wasn't for chronic illness. I
Right.
wouldn't know who a lot of amazing people are. I wouldn't have learned from other people or been able to be inspired by other people or,
Hmm.
make these connections and help other people if it wasn't for what I went through. So,
Yeah.
like, I think about that sometimes where I'm like, this is, you know, it's not toxic positivity. It's not negating the trauma or the bad experience or the more negative parts of this, right? But it's just like another way of looking at life of you
Hmm.
have this and you have that and you can sprinkle whatever you want on it to make it feel more comfortable for you. And however you
Hmm.
need to do that is if that works for you, that's great. And I'm happy that it works for you. And like for
Yeah.
me, digging in and really saying, like, what can I do with this? Like, what is the point of this? Do I want to just sit here and sit in it? I might need to for a little while,
Yeah.
but eventually I want to get up. And if I inspire you to do something, if I'm going to be an inspiration, I want to inspire you to just keep going. It's
Hmm.
like, I'm not going to sit here and say, if I could do it, you can do it too, like I used to do, where I thought that
Right.
was being helpful. And I'm like, well, I figured out a way to do it. Let me help you figure out your way to do
Your
it and
way.
let's go from
Yeah.
there. So it's like
Right.
the same thing with a different attitude. And I think that in what we do for our day jobs, for how we share our story, how we advocate for ourselves, for others, like our personalities end up in how we advocate and our experience ends up in how we advocate. And depending on what we go through that day, that year, that illness changes that. So it's so dynamic in so many different ways that you don't even realize until you're in it. And I
Right.
don't know how to explain that until you're in it. And it's a club.
Exactly.
I will welcome you with open arms if you ever have to be in here, but we don't want you, but if you're here,
Right.
we accept you.
Yeah,
you know?
exactly. Right. Oh, 100%. You just said it perfectly. It's like some of my closest friends are people who I've never met before, who also have
Mhm.
chronic illnesses, who I've met online, and we just, click because we already know that we come from some sort of like understanding
Mhm.
of, life is hard,
Yeah.
but we're going to use it however we can. And I think that's one of
Yeah.
the like superpowers that we have is adaptability and,
Yes.
being able to think on our feet because, if chronic illness life is one thing, it is just like living with uncertainty
Mhm.
and being able to, kind of switch course. So I think that's something that, a lot of us kind of don't realize is a huge strength.
Mhm.
That can be then applied to our professional lives, other parts of our
Yeah.
personal life. So, yeah, I definitely agree.
Yeah. So, speaking of professional lives, so with you, one of the things I know that we had talked about talking about
Hmm.
was, that trying to find that balance. And sometimes I hate saying that, but it's like when you are an advocate in your personal and professional life, that line gets blurred so often, and
Mhm.
it can be very difficult to pull back and put up some boundaries because you want to be there in your professional life for either the person or the event or the cause that you are advocating for. And I know, I'm like, I know the answer to this, but we'll we'll talk it through
Right.
anyway. Of like, how do you find, or what works for you in finding that balance to say like no to things, even though it's something that's meaningful to you, but like, I just I need to hold on to this spoon for me right now. I can't give this away. Like, what do you do in that
Yeah.
situation?
Once if you figured it out, let me know. Um, some days I'm better at it than others, but it's yeah, especially when you have so much passion, like you were saying that you want
Mhm,
to do something. It's hard, but I think that once you overexert yourself and don't set boundaries, then you crash and you're like, oh,
mhm.
this is why I can't do this.
Yep.
But I feel
Calling
like
me out, are you?
yeah,
Yes.
but I feel like we're all guilty of it. It's like on days
Mhm,
that we feel good, we overdo it. And then the next day you're like, oh, I shouldn't have done that. Let me try and remember that for next time. Sometimes you do, sometimes you don't. Um, but I feel like one of the things that so I started my business 2 years ago, and I have really been trying to honor my cognitive bandwidth in terms of
mhm.
scheduling meetings and stuff like that. Cause I'm like, oh, I really want to talk to this person. Let me load it up on this day where I already have 3 meetings. And then I'm like, no, my cognitive bandwidth is going to be really low, brain fog and physical energy too. So I feel like you learn from fumbling along the way and learning what you really need to feel good. But it's
Yeah.
always, it's really tough and it can be just like emotionally draining when you use your personal experience and are advocating in your professional life because there's still just like misperception that sometimes what we bring to the table is not valuable,
Yeah.
and it can just feel like a struggle every day. But then when you connect with people who are like, oh my gosh, what you do is so important and blah
Mhm,
blah blah, you're like, yes, like someone gets it, and that kind of helps you get the boost to fight another day. But
mhm.
there's no easy answer. Some people I know are like way better about saying no and setting those boundaries. It has been a work in progress for me.
Mhm.
Um, but yeah, anybody out there, we'd love to hear what your
Yeah.
skills are for that, your little tricks. But it also really helps to have other people. Like I'm in a Slack group now, and just this morning, one of my friends was saying, I'm sick on top of my chronic illness, and I'm going to really try and we say a lot, give myself grace,
Mhm.
to realize, okay, I need to prioritize my health and, you know, my ability to function as much as possible.
Yeah.
So it's a learning experience. None of us
Yeah.
are, you know, told how to do this.
Yeah, I definitely like as you're saying, like cognitive function and all that. I'm like, oh, doesn't want to look at my calendar for tomorrow.
I
Um,
know. Because every time we talk, you're like, oh, I did all of these things. And I'm like, girl. But we go
it,
through like
hmm
phases. Sometimes we have that energy.
yeah,
Other times,
yep.
like getting sepsis and being impatient, you got to take a
hmm
beat. But
Yeah, my
yeah,
husband brought me a laptop while I was in the hospital, so there was that. I'm like, things don't stop for me, but you know, I do find too, to a degree, that especially with the work that I do with G-PACT and what we're building here, that there are things that are work that bring me joy. Like
yes.
doing these bring me joy. I love talking to other people and hearing other people's perspectives and their stories. And when we have, other experts coming in, I'm like, I learned so much every single time. So sometimes like this doesn't feel like work. It's like it's just a thing to do. I'm like, hey,
Right.
I'm just, having a conversation with somebody that I really like and I'm enjoying it and I might get to learn something too. Like that's really great. And then I think about all the other people that might get to learn something and take something from this too. So it helps at least for me with what I do here to balance that out a little bit. And like my schedule for tomorrow wasn't as full as it was like a couple days ago. I'm like, oh, that looks good. And then all of a sudden I was like, oh my goodness.
What I
Like
do?
who who got my calendar?
I
Like
know.
what?
I know. I'm
What?
always like, past Meredith. Like,
Mhm.
what did you do to future Meredith?
Mhm. Like, damn you. Yeah, I have those conversations with myself a lot. But I've realized too that like I do need to say no more. I have gotten better, but I think with especially this niche with gastroparesis and GI disorders and what we're trying to do, there's there's so much work to be done, and I see that, and my personality is like, "Yeah, I'll do it." And I'm
Right.
like,
Same.
"Why did I do that?" Like, it's like you raise your hands and you're like, you say, "Yeah, I'll do that." And then I'm like, "I don't I don't even know how to do that. Why did I just volunteer for tribute? Like, what is
Yeah.
wrong with you?" And I have these conversations with myself. I am, like you said, we're works in progress for this sort of thing. But I think, especially given the nature of the work and who we are as chronic illness patients fighting for and with other chronic illness patients, that
Hmm.
it's really hard to say no. And I think about like where I was years ago where I couldn't get out of bed because I was
Right.
so malnourished. I
Yeah.
thought I was dying. Every night before bed, I just prayed that I would open them in the morning because I
Yeah.
did not know if I was going to survive. I didn't know
Hmm.
what was happening. Everything was slowing down. And I'm like, I'm doing this for her. I am
Yeah.
doing this for her, but also don't go back to being her because you're doing too much for her. Like, I have to have that conversation with myself of like, I know what you're doing, but you have to like, what have we learned in the last decade plus of doing
Right.
too much? And my my too much changes. Like you were talking
Right.
about, like when you have a good day and you can give, let's say, 75% effort with little to no repercussions, right? So then you feel good again. Now it's 50% effort with a little more repercussion. Like you never really, that's such a sliding scale that like
Right.
I've never been able to figure that out. I don't know anybody that's been able to figure that out because of how dynamic illnesses are.
Right.
And, it's like trying to figure out where your boundaries are. How do you set them if they keep moving?
Yep. Exactly. Uh, yep. You just said it. But I think it's true what you're saying about, some things like conversations like this really fill your cup. And even if they're
Mhm.
like work, you know, you know that this will fuel you and make you feel, oh, like I'm doing something good that, makes me feel like I'm helping people or
Mhm.
versus something else where you're like, okay, I'm gonna have to like have this, you know, businessy robot-y call.
Mhm.
Um, but it's like so I love helping other patients with care navigation stuff and how to be a better self-advocate.
Mhm.
And so that's something that I will like never, you know, charge for. That's what fills my cup. Um and like 2 weeks ago or something, a one of my husband's coworkers, she has IBD too, but so he asked, would you be open to talking to her? I'm like, yes. And so we got on a FaceTime call. We talked for like 2.5 hours, and she has had no one to talk to about this. She's been living with this for years.
Oh
She
my
has felt
gosh.
so much like shame and has been really kind of, there's still so much stigma around GI stuff and
Mhm.
just people not understanding. And so I was just like, okay, I'm going to tell you all these things. If you get overwhelmed, let me know. But she's like, no, I feel so seen. I've never felt like this before. Like I've
Oh
never
my
had anyone to
gosh.
talk to. And just, giving her both that emotional support and validation of like, this life is hard. I see you. Everything you're
Mhm.
saying is, true. And, you're right to feel that way. Um, and brain fog. And and so I got off the call and my husband had been there kind of listening to
Wanted
some
to say hi.
hello.
We'll just
Oh
take a
my
kitty break because
goodness.
she wanted to say hi.
Hey, kitty break. Um but so my for most of it, my husband had his earbuds in to give us privacy.
Mhm.
And then at the end, he, kind of took them out after I stopped the call. And he he was started to get choked up. And he was like, I I just love seeing how much you light up when you're helping other patients. That's like the reason that I fell in love with you. And
Well, that's gonna
he
make
started
me
crying and
tear up.
I was like, "Oh my gosh." Like so it's just, something that feels natural to me. And
Yeah,
but it's I don't know, that just really meant a lot to me.
that's so
Um
sweet.
and yeah, he always says that. He's like, "I don't care if you don't make money, just I want you to get so much joy out of helping other people, and if that's all you do, we'll figure it
Yeah,
out." But
yeah.
yeah,
Wait,
that's
are you
why I
married to
think
my husband? Because he says the same thing.
oh, we lucked out.
Yes,
We
yes, we
really lucked
did.
out.
Yeah,
Yeah.
it's
Ugh.
that purpose, that feel, like, I know I felt a couple different ways about, like, what I do as an advocate, and, like, I've never done one-on-one advocacy other than, like, what
Mhm.
you're talking about, where someone's like, "Hey, do you mind, like, having a conversation about this?" Or, "Do you have any thoughts on this?" Or, any suggestions, and I've worked in a lot of, like, larger advocacy helping, people, and I love being able to give somebody hope. And there's been times where I'm like, I wanna storm everything. I wanna knock down all the walls in healthcare. I wanna fix the problems. I wanna get more providers. I wanna fix insurance companies. Like, I still feel that way. But I feel like if we can, at the end of the day, like, really educate patients on how to advocate for themselves, give them some hope in how to do that, and as just a human, that, like, yes, your life is gonna look different, and maybe what you thought it was gonna be isn't what it is, but let me show you again how you can find something that works for you, because that is what breaks down the walls, because once there's more of us that are all, I don't wanna say in line, but all of us are, like, together, holding
Right.
hands, holding
Yeah.
each other up, that's what dismantles the bullshit. That is
Yeah.
what pushes us all forward. So, like, that conversation that you had with that person, like, she finished that feeling like, I'm not by myself anymore. I'm not
Mhm.
crazy for how I was feeling. I matter. Somebody heard me. I feel validated in my experience right now. And that in itself is what fuels the fire for the next advocate, for the next person. So when a doctor gaslights her, she's like, "Excuse me,
Yep.
no, I do not accept this." And you were a part of that for her, and that is so amazing. And it's why we do this. It's why we keep talking about the hard conversations and finding other people and reaching out and overextending ourselves a little bit, because at the end of the day, it is worth it. It's just sometimes, we know what we're doing, we just ignore
Yeah.
it.
Exactly. A little self-detrimental, but yeah, I always say it's like I've acquired the degree I never wanted to have of like
Yes.
how to navigate our
Yes.
healthcare system. I mean, there's always something new every day. But like on
Mhm.
that call, I gave her like tangible kind of battle plan of like, okay,
Mhm.
when you get off this call, you're going to email your PCP. If you don't hear from, like, you're going to immediately call them first thing in the morning too
Mhm.
and say, okay, I look forward to hearing from you by the end of the day. And if
Mhm.
that doesn't happen, so it was like very specific things that otherwise we like, you wouldn't know that you needed to do because we've seen where the system breaks down and where you have to really be on top of it.
Yeah.
And, like, in my non-health life, growing up, I've been much more of, like, a people pleaser, don't make waves, like,
Mhm.
just, go with it. But after all my health stuff, I'm like, you push
Nope.
back. Kind of getting over that, which I think a lot of people have, is like that white coat kind of syndrome of,
Yeah.
okay, you know what you're talking about. I'll do what you say. And, but doctors have saved my lives. I have some incredible doctors, but um yeah, you have to stand up for yourself. But most of us, unless we've been through it, we don't know
You
how
don't know
to
how.
do that.
Yeah,
And so I think that those have been some of the most valuable conversations I've had with people. Um,
absolutely.
yeah.
Yeah,
So
it's hard, and I know, like, what's funny is as a person who's an advocate for myself, for a larger community, been in the advocacy space, like, there have been times where I've been hospitalized where, like, especially even in this last hospitalization that I had, where I look at my husband and he's like, "I know you're defeated." Like, at this point, like, I
yeah.
know you're done and you need me to step in. And it's interesting to feel like that because more often than not, I'm like, I can handle myself. Like, I know the laws, I know the rules, I know how to take care of this, I know what I need, and I will tell you that. But after like a certain amount of days go by, or a certain amount of situations happen, or you're talked
Mhm.
to in a particular way from somebody, it's like, I just can't. And, I'm lucky enough to have, if my husband's not there, my mom has been there, to have somebody there with me to step in who understands my conditions and does not back down in the
Yeah.
most respectable way possible, but will
Mhm.
not back down. And not everybody has that. And that's where, for me, wanting to show other people, like, these conversations and that you can do these things, and that when you're in a doctor's office, and I've said this a couple times, but it's like you have to be smart enough to understand what's happening, but you have
Right.
to hold back a little bit so they don't feel intimidated by
Yeah.
your lived experience. You have to be put together enough so somebody takes you seriously, but not
Mhm.
too put together so they stop taking you seriously. It's
Yes.
like, and you have to have these conversations like, do I wear my hair up or do I wear it
Yes.
down?
Do I put
Do
on
I
makeup or do I not? Yeah.
do I do I
Yeah.
just show up as is and hope for the best? What do I do? And unless, again, you've been in that situation, you don't think about those things. And
Right.
it's like, the more conversations we have, the more that medical professionals or anybody in an authoritative position in the medical field starts to realize that we have to do this on
Mhm.
top of getting to the appointment, taking your meds before you go, getting dressed, putting socks on is freaking difficult
It's really
sometimes, let alone
compression
having,
socks.
getting them off.
Getting them off, especially if you've, like, done your nails.
Yeah. It's
But
like putting a freaking bra on sometimes, like, getting out of
Yep.
bed, the most minute things to everybody, or the majority, I should say, is so difficult that now when you're in the room, you have all these other things running through your head, like, especially if it's a new provider or a new something. And it's like, how do I have this conversation? And I had a hospitalist. This turned out to be a good thing, but
Mhm.
the first interaction with him, when he left, I took one look at Adam and I was like, "Absolutely not." Like,
Mhm.
absolutely not. I did not like how he talked to me. He was like, "That's
Yep.
not a thing. This is not possible." Very much like, kind of conversation with me. The next
Yep.
day, after looking at my records, talking to the other physicians, came in and was like, "You were right."
Wow.
And I was like,
Say say
"Hold your
say say what?
hold your shock." And I'm like, "Say what?" And he's like, "No, I did some research. I looked at some stuff. Like, yeah, so let's figure this out." And I'm like,
Yeah.
is this a fever dream? Because I had a fever earlier. Like, what is going on? And I'm like, I have never experienced that before. Like, to have somebody, like, to be in that situation. And again, like, running through my head here in the previous conversation, like, I need to be assertive but not aggressive. I need to be forceful but not angry. I need to be kind but not too kind where you step over me. I need to, and then I walk out of that well, he walked away. I was still sitting there, but like,
Yeah.
you walk away from this conversation and I'm like, I never want to see him again. And after that, we had like the best experience and communicating and everything. And I'm like, why can't it always be like that? For the patient too, because we're not always right. But and I understand, like, our medical professionals are burnout. They've had it. They see maybe hundreds of people in a day, especially if you're in the hospital. But like, at the end of the day, that is not my concern. I'm my
Yeah.
concern. So,
Right.
like, like, we struggle with this and we do this freaking professionally, right? And
Mhm.
we've done this for years and we struggle with it. And like, the more that we say these things out loud, the more we talk about these things, even down to some of the stigma around having GI disorders. And sometimes you poop your pants. It
Yep.
happens. Like,
It happens.
sometimes things are uncomfortable, and sometimes, it happens. But the more we actually talk about it, that's where change starts to happen. And like,
Yeah.
every patient that you have talked to that has gone to their doctor with their battle plan, with their next steps,
Mhm.
has made an impact in their life, that ripple effect. And we just keep doing it more and more and just never stop.
Yeah. Yeah. I treat every appointment like a business meeting now. Write up an agenda beforehand. I send it to
I
my
love it.
doctor. I say, these are the decisions we made last appointment. This is how things have progressed. These are the things I hope to get out of this appointment. Like, these are my
Hmm.
questions. Everyone I've done that for has been so, has been really, for it, has been thankful. It's like, this is really great. This is helpful. And it's been, especially with brain fog and sometimes anxiety when you're going in there and all those things are running through your head. Like, I want to advocate for myself, but I don't want to be seen as like adversarial or like difficult, which that's a word. You're a difficult patient and
Non-compliant.
non-compl so, you really do, and I think that's also, like you said, providers are like, "Oh, like, she knows her stuff and is, my equal in terms of you can be an active participant in your care." I was lucky enough to be invited to speak at Grand Rounds at Hopkins to the psychiatry department, and,
Love that.
I, wrote up a whole thing, was hoping I could have, 5 minutes to talk, and
Hmm.
then, I had, 1.5 minutes, and so I just wanted to get across the concept of participatory medicine and, how to
Yeah.
build good patient-provider relationships, and I was like, hello, you are all wonderful. You need to understand that, in order to create a meaningful patient-provider relationship that's gonna benefit you, it needs to be
Hmm.
built on respect and trust and the recognition that we know our bodies best. Even if we didn't go to medical school, we live with this every day. And you need to recognize that, we are equal partners in making our healthcare decisions. And
Yes.
that's really, once you find a group of providers that get that, that, that's what I have now. And that's why
Hmm.
I'm able to sit up like this
Yeah.
because they take what I have to say and you know, and work with me. I don't want to try this medication. No, this is really what I'm feeling. It's so important in that
Yeah.
communication aspect. Yeah, I
Yeah.
was hospitalized during the pandemic. I've had kidney stones a lot, and so I had a double room, and Ryan couldn't be there because it was the pandemic. They just threw me in the ambulance and then closed the door. And I was like, "But husband?" Like, "No, sorry,
Hmm.
he can't come." And so that was one
No,
of the
my
only
emotional support
hospitals.
husband.
Yeah, because when you're, in pain, someone has to, like you were saying, be there to step in when you aren't able to.
Yeah.
But that was the
Yeah.
first hospitalization I've had where I had no one there, and I had a a shared room, and there was like a curtain between us, and there was I think a girl maybe about my age, and doctor came in and talked to her, and it was not okay. And after they
Oof.
left, I was like, I am so sorry. That was really effed up. Like, I'm here for you. Like, I
Yeah.
didn't mean to eavesdrop, but he's right here talking.
It's just a curtain. Like, you're not eavesdropping. It's just like it's a
Exactly.
curtain.
Yeah. So, yeah, those moments, especially when you don't have anyone to step in, are tough. But yeah, equal partners. We know our stuff, but it
Mm,
is hard because so many of us know how to mask really well because we have
yeah,
to in the world. Like, I'm in pain constantly, but I put on makeup. I did my hair. And you
you
really have
look
to think
fine.
about that when you go, yeah, I look fine, but I'm in like 6 to 7 out of 10 pain. And so you
Mhm.
have to think about those things, which
Yeah.
is, it's, it's really hard.
Yeah, we're damned if we do and damned if we don't. Because if
Well,
you are too put together, then your pain is not believed. But if you're not put together enough, they're like, "Are you sure not in pain because you didn't try hard enough?" It's like,
yeah,
hmm?
yep. And those are
It's
the things that we learn from each other
yeah.
how to navigate.
Yeah. And that's why, like, I mean, one of my 2026 resolutions was like learn new words because I say the same thing over and over again. But I also realized that it's important, like, again, why these conversations are so dang important, because somebody out there is going to be like, I didn't know that this was not just
Right.
me. Like, I thought
Yeah.
I was the only one that felt like that. And that's like the whole purpose of us starting this podcast was behind that message of like, if I'm a person, I consider myself a relatively educated patient and a relatively educated human being, and I live and breathe this world. If I'm questioning things,
Right.
I know somebody else is questioning things. So that
Mhm.
means that these are things that need to be talked about. And the more I said something, the more we talked about things that like people whispered about but didn't talk about. They're like, "Thank you for that." And I'm like, "You're welcome. It embarrassed the hell out of me, but I will take one for the team because that's what we need to do." And I'm no
Exactly.
longer like, it's still vulnerable for me to put myself out there and have these conversations and talk about these things, especially when it comes to how I handle a doctor's appointment, because I'm like, I don't know if that's going to come back and bite me in the ass, but if it helped somebody else, then it was worth it. You
Yeah.
know,
It's so
it's
true.
it's crazy. It really, and I'm so grateful to the community and like us being able to connect, because like we said in the beginning, you don't have to have the exact same things to get it.
Mhm.
Like when we've had to reschedule and we're like, "Hey, I've got this." And I'm like, "I got it. I gotcha. Like, do you want to talk about it later?" It's
Right.
like you don't have to have the same thing to understand. And I think that being part of community and really focusing in on having that hope and having that knowledge and having that feeling of just, I'm not always in this alone. We're going to have moments of isolation. We're going to have moments of feeling like that. No matter if we're in a room full of 1,000 people, we still are probably going to feel alone at one point or another.
Yeah.
But it just it takes the edge off that a little bit. It helps, and I'm just so grateful to you for this conversation and all the other conversations that we've had, and your you know
Thank
your
you.
your thoughts and your opinions and your feelings and your comments on everything we've talked about. They're so valid, and I know you know that, and I don't have to tell you that, but they are, and I'm just so glad that you are willing to share that with our audience. So thank you so much.
Thank you. And it is so important. And sometimes, you're like, this is what I do every day.
Mhm.
This is just normal. But when you have other people who get it and remind you, like, what you're doing is pretty cool and it's making a difference, you're like,
Yeah.
oh, yeah, I guess it is. So it is so meaningful, and it's just a very special connection. So
Yeah.
yeah, thank you so much.
Yeah, thank you.